Hello and welcome to episode 46 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott, with the RehabFix online low back program. And today's topic is degenerative disc disease. Another video that I wish I did not have to make, but I do. I do because of how much misinformation is out there about disc degeneration, degenerative disc disease. What does that even mean? We're going to dive into it. First off, if you did not catch episode 45, it's actually a very important podcast, discusses when imaging is needed. I talk all the time about how imaging usually is not needed, can make your situation worse, can lead to unnecessary costs, unnecessary interventions, unnecessary surgery. But how do you know when you actually need imaging? You understanding this information is crucial to you being in control. Today's topic, though, is DDD, degenerative disc disease, and why it is absolute nonsense. It drives me crazy. What prompted me to create this episode was about a week and a half ago, or maybe 2 weeks ago, I got a message from a potential client that was intriguing about my program, my services. I was saying, let's figure out what's going on, submit an application, let's do this thing. And I didn't hear back from him for a few days, and so I reached back out and I said, hey, what are we doing? I thought you were, wanting to do this thing. And he replied and said, well, yeah, I was going to, but I decided not to now because my primary said that we want to get an x-ray. And I replied, and I said exactly what my last podcast was about, which was, well, typically an x-ray is only indicated if you're suspecting infection, fracture, or tumor. Something that would indicate some severe reason for low back pain after you've exhausted a trial of conservative therapy. They had not done these things. And they replied and said, oh, well, they just wanted to check for disc degeneration to see if that was there. And I got to tell you what, that face palm emoji just, it represented everything that I felt. Okay. And I'm not pointing fingers at the individual. I'm not blaming the individual. Nothing that I'm saying has to do with the individual. It has to do with the provider that convinced them that they needed to get an x-ray to look for disc degeneration. And I replied back and I said, I can guarantee you're going to see some disc degeneration. Unfortunately, that doesn't tell us anything about your body. And I didn't get a response. And unfortunately, they're most likely spinning their tires because that's one of the worst reasons you could ever justify getting an x-ray. It's almost comical amongst the evidence-based practitioners in our healthcare system. And the reason why is because degenerative disc disease is defined as a degenerative process or observation of the intervertebral discs, also sometimes referred to as spondylosis. Spondylosis basically just means spine deterioration, usually related to arthritic changes. Okay. What does that mean? It means the spine is getting older. That's what that means. Spine is getting older. If I told you you have degenerative face disease, what would you think? You'd be like, excuse me? I'd be like, yeah, look at your wrinkles. Look at your hair. Your hair is turning gray. What's wrong with you? You have degenerative face disease. You'd be like, you're a lunatic. I'm going to go to a different doctor because that is ridiculous. But when someone says, you have degenerative disc disease, your spine is aging and you have degeneration, you're going to need surgery. You're going to need drugs. You're going to have to live with it. You're going to need all this and you're not going to get better. And our response is, oh my gosh, oh no, oh no, oh no, oh no. And once again, I'm not blaming the individual. You're supposed to trust your provider. But I hope you realize how ridiculous that is. If someone's telling you that your face getting older or your body on the outside is getting older, right? Wrinkles, gray hair, those are external changes that resemble aging. So why would there not be internal changes that resemble aging. It only makes sense, right? What's wrong with that? It's foolish to call these things a disease. It's not a disease. It's called aging. With every candle that you add to the birthday cake, your spine's getting a little bit older. So is your face. So is your skin. So is your hair. It's totally normal. Why would we ever expect an 80-year-old, they look 80 on the outside, they move like an 80-year-old, to have a spine that looks like a 20-year-old? It doesn't make any sense. It doesn't make any sense, right? Your spine's supposed to look older as you get older. It's supposed to. That is normal. It is not a disease. Degenerative disc disease is a bunch of BS, and you need to stop being fooled by providers that are trying to sell you something on that, because it's not true. It's not the reason for your pain. It is nothing, and I want you to think of it that way. Okay? That is the main premise behind this podcast. Everybody will get, quote, degenerative disc disease. Everybody will, because it's not a disease. It is not a disease. Nothing is wrong with you. But then someone might say, but Grant, I have low back pain. And they took an x-ray and I can see the discs degenerating. So how do you explain that? And I'd say the way that I explain it is that it's not because of aging discs. That's not the reason for your pain. Something else is. I've made multiple podcasts on blaming what's on the image for your pain. Asymptomatic findings on imaging, X-ray, MRI are extremely common. Extremely common. Just because someone has degenerative or normal age-related changes on their spine does not mean that's the reason for their pain. Just like someone who has shoulder pain and gets an MRI and they say, oh, there's a labrum tear. It doesn't mean the labrum is the reason for their pain. This happens all the time. Hip pain, they get an MRI. There's a labrum tear. Does not mean the hip pain is because of the labral tear. I've had multiple clients with sciatica and low back pain that received an MRI of their hip. They said, oh, you have a labral tear. We need to do surgery. That's what's going to fix your sciatica. They were kind of hesitant. They contacted me. We started fixing their low back. Hip pain went away. Sciatica went away. Labrum was not the problem. Their hips are completely fine with a labrum tear. Asymptomatic findings are so common. Okay, so if someone says, well, if I have back pain and there's aging going on in my spine, how is that not the problem? Because the image does not tell you what the problem is. It rarely does. Something else probably is that you can't see on a picture. I think it's a lot more effective to actually assess a person, talk to a person, listen to a person, than to just snap a picture of them and try to judge their entire story based on a picture. It's a highly ineffective way to go about helping someone with low back pain or any pain for that matter. So just because it's the only thing you see on an image does not mean you should blame it. Okay? Just because it's the only thing you see on an image does not mean you should blame it. It's probably something else. And this is a very common inquiry that I get from some of my new client applications. It says, I have DDD and I understand nothing can be done about that. I'm not sure if this program is for me then because I have DDD. And I reply with, DDD means nothing. Degenerative disc disease, that's DDD, means absolutely nothing. It means nothing to me. Or sometimes I'll get an email and they'll be like, hey, but does your program address these kinds of issues? I have disc degeneration. And I reply with, that means nothing. Telling me that you have a spine that's older than it was yesterday, which is the reality of what you're telling me. If you're telling me you have disc degeneration, that tells me, oh, your spine is older today than it was yesterday. It means absolutely nothing. Okay, it's this perpetuated nocebic, if that's a word, nocebic info that has just been circulated around the healthcare system and amongst the individuals that it affects. It's bad. And I want you to forget it. I want you to sweep it under the rug because it's no more important than that. It's no more important than that. Sweep it under the rug. Who cares? That's my response for you. Who cares? So no more DDD, no more disc degeneration. Once again, it is no different than wrinkles or gray hair of the spine. That is absolutely what it is. It is nothing more. And I do not want you to worry about it any more than you would some wrinkles or gray hairs on your head. If you or anyone you know has been told that you have DD and this is the reason for your low back pain and you're not getting results with what they're telling you to do, then contact me. Submit an application. Let me help you. Let's put together the right plan for you so you can achieve results quickly and focus on results and none of the nonsense that might be out there. Let's get you off that medical gerbil wheel that has you spinning round and round, okay? Share this with a friend as well. Please leave a 5-star rating and review on Apple. If you're watching on YouTube, please like, comment, and subscribe. Move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.